The proceeding is currently in
Order, and welcome everybody to this meeting of the Work and Pensions Select Committee, our first evidence session in our inquiry on the devolution of employment support. And we're very grateful to the four witnesses joining us for the first panel this morning. And can I ask each of you very briefly to tell us who you are, starting with Christopher Rocks.
Hi, I'm Christopher Rocks. I'm from the Health Foundation, an independent charity. I'm a lead economist and head of Secretariat for our Commission for Healthier Working Lives.
Thank you very much. Andrew Phillips.
Good morning, thanks for the invitation. My name is Andrew Phillips. I'm a senior researcher at the cross-party think tank Demos.
Thank you. Tony Wilson.
Good morning, I'm Tony Wilson. I'm the director at the Institute for Employment Studies.
Thank you. And joining us virtually, Sinead O'Regan.
Hi, Tony. So I'm Sinead O'Regan. I am the Employability and Skills Manager in Belfast City Council.
Thank you all very much for being here. And let me, if I may, put the first question to you and ask each of you to comment on this. How much variation is there between different areas of the country in the drivers of unemployment and of economic inactivity? Do you think further devolution of employment support makes sense in response to those variations? And do you think the appropriate degree of devolution will differ between, for example, urban and rural areas? I'll ask each of you to comment on that, starting with Chris Rocks.
So I would say, in terms of the variation, we know there is variation, both in the health challenges, for example, faced across different areas, the extent of that, and variation in things like economic inactivity patterns and economic inactivity due to long-term sickness. It does vary across the country. It's particularly high in parts of the northeast and northwest regions. I would say, in general, a lot of this correlates with what we know about deprivation. So kind of areas with higher levels of socioeconomic deprivation also have higher levels of challenges around health and inactivity and unemployment to some extent as well. So I think the first point being that there is variation. I think if we look at what's been happening over time, I think we've seen a sharp increase obviously in economic inactivity due to long-term sickness, in particular recently, and I think some of that has reinforced existing inequalities. In terms of the drivers and the kind of the health drivers, I think we know there are significant inequalities. So I think we've done a report, colleagues in our Real Centre have done a report on health inequalities in 2040, which explores some of this variation in some of the factors affecting health. And some conditions like COPD, chronic pain, anxiety and depression, I think the rates, the prevalence of those conditions is significantly different between the most deprived and least deprived parts of the country. So I think that has a significant impact. There was a lot in your question. I mean, I think in terms of does devolution have a role to play in addressing that? I think perhaps. I think there's probably a level of nuance to bring to that, but clearly some of the challenges differ across different areas. I think we know, just on kind of some of the health challenges, I mean, there are common challenges as well. So I mean, I think about musculoskeletal issues and mental health issues, they do come out quite commonly across the board, but the extent of those challenges would really differ. And some of the, at a very local level, there could be differences with different demographics playing at kind of a hyper-local level as well. So I think there's different levels to that. I think I shall pause there. Maybe I can hand over to colleagues to come in, but happy to follow up.
Thank you. Andrew Phillips.
Yes, so agree with Christopher that there is significant variation in different areas of the country, as well as differences in drivers of unemployment and activity. I would also say that a lot of the differences are related to demographics, and when we're thinking about devolving employment support, it's really important that those programmes work for the demographics of the local area or the region that you're looking at. We did some research looking at the area of East Birmingham and North Solihull, which is a particular area within the West Midlands that has quite high deprivation and quite high unemployment. And it also is it's a very young area, has a large proportion of young people. So there are both kind of some demographic factors and then also a range of other factors like, as you mentioned, urban, rural, and also kind of things like cultural factors that will make a big difference to the kinds of support that people need, and not just employment support, but thinking about how do you join up services across a local area so that they work together well for local communities.
And do you think, given those factors, that devolution of the employment support is an appropriate response?
Yes. So there's both a couple of advantages of devolution of employment support to respond to those. So one is flexibility, so giving local areas more flexibility around how they deliver employment support, and making that, adapting that for different areas of the country depending on some of those different factors I mentioned. And we already see some of that in different areas. So that I think we've made progress on in the last few years. The other big potential benefit is integration, so joining up different employment support services, joining up employment support and skills, joining up employment support and health. That kind of joined up local working is more likely to happen in a more devolved system. It's not inevitable, because the way that devolution is done will make a big difference to how much of that kind of integration and joined up working happens or not. But it's a potentially big benefit, and I think we know that there's lots of evidence to show co-located services, for example, can be effective at improving outcomes.
Thank you very much. Tony Wilson.
Brilliant, thank you. So maybe not much I can add to the previous contributions. I suppose I'll make a few points. One is that there are definitely variations. We can think about those in terms of labour markets and labour force, or the populations, if you like. But also third areas around the kind of institutional capacity and capability of different actors to join things up or do things differently. So on those labour market, we've talked about some of the labour force differences and some of the variations around which are related to disadvantage and wider socioeconomic factors. And those are really pronounced, like ex-industrial, coastal, some inner city areas, much higher rates of economic inactivity, much more long-term worklessness. That's compounded by often a lack of access to good quality work as well, and those two are kind of linked. So when we think about devolution, we also need to think about this in the context of wider sort of local economic growth. So how do we create the demand for jobs in disadvantaged areas and also improve the supply, the availability of a workforce to do that? And there's a lot of areas, a lot of levers we can put on that. Employment support, employment services is one kind of small part of that, but it is an important part. So then, can devolution make a difference? Yes, definitely. We talked about some of the regional differences. Differences within regions are even bigger than the differences between regions. And when you get down to that more local level, the differences within local authorities are bigger than the differences between local authorities. And the lower down you go, we find we do have quite high rates of inequality, and we have cheek by jowl areas that are relatively prosperous and relatively deprived in the same, occupying the same sorts of spaces. So that's also a bit of a kind of a challenge for devolution, because we can't integrate everything, but also we can't devolve to the very, very local level everything. So we need to think about what are we devolving where and how, which kind of links to Andrew's point. I think there's two concepts here. One is around devolution of powers, funding, policy, responsibility, control. And I think there's some really good work being done by combined authorities. And also there's great work in Northern Ireland's a great example, actually, where a really significant devolution. But then alongside that is localisation. How do you localise service delivery? And you don't necessarily need to devolve policy, money and control to the very local level to have much more localised and effective service delivery. And that is a challenge that we need to address, regardless of where we get to on the politics of devolution. Job centres need to work much, much better with other local services. We need to have much more co-location. We need to have much greater access to services. We need to make better use of the 600 plus offices that we've got, and use that to help drive better integration and service delivery locally. So speaking to your rural point as well, I do think that's a particular challenge, because I think this also links to, this is where the kind of labour force, the labour markets and the capacity all kind of come together, is we can't expect every local authority to have the same level of capacity and capability around running an employment service or commissioning programmes and so on, but nor should they necessarily need to. It's okay to take slightly different approaches in different places, but the priority even so should be that everywhere we have localised services that are joining up other local actors, and that ideally funding follows those needs too, that we can link up with, we can link up with transport support, we can link up with housing and community services, and we can link up on the economic development side and things that will help to create more prosperous communities, better access to employment and more local jobs as well.
Would you say, is Job Centre Plus sort of working on that localisation that you've...
Well, yes and no, and I think Job Centre Plus does a really good job in many different respects in running, dealing with hundreds of thousands of new claimants every single month who become unemployed, who turn up at job centres and need help to get back on their feet and find new work. It's a significant large-scale service, and you can see why there's been a move towards delivering that in a fairly centralised, standardised way. And there are arguments around ensuring consistent standards, consistent quality of standards, economies of scale and so on. The challenge for localisation, though, is that there isn't really much capacity in the Job Centre Plus local management tier to effectively join up locally, and there isn't really a culture of seeking forgiveness rather than permission when you want to do things differently in a place. So there are some places where more of this happens, particularly in combined authorities, where there's much more alignment between and much more engagement between Job Centre Plus and local partners. There are other places where it really doesn't.
Elaine wants to come in.
Thank you, Chair. I just wanted to come in on one point that you made there about getting jobs into those sort of deprived areas. So my constituency, I have a very deep, small pocket of deprivation, which is rural and coastal. But what we've actually found there is that there are some really, really top employers, but we don't have any skilled workers. So what we've actually seen is that the jobs have been de-skilled to match the workforce. Do you have any thoughts on how you can turn that model on its head, because it's the highly skilled jobs that sit there vacant in my constituency because we don't have a skilled workforce? And I don't feel we can lean on the employer for that. They're sat there looking for staff. How do we turn that model on its head?
Well, this is a really common refrain now. This is a common challenge now, because there's a lot of the story in the labour market has been around labour shortages. It's been around economic inactivity is high. I mean, it is high. Employment has come down a bit. Well, the rates have come down, but the level of employment is still pretty high. So we do have labour shortages, but actually skill shortages have become more pronounced too. So about 1/3 of vacancies now, employers classify as being due to a shortage of skills. 1 in 10 employers currently have a skill shortage vacancy. And I think part of the challenge, although it's really important, we've been focusing a lot on work and health and engaging people who are outside the labour force, and we need to focus on participation, raising participation. We do need an equal focus on linking up skills and employment. And I think we've lost sight of this a bit. I think we have, these now operate, these are probably less joined up than have been at any point in the 25 years I've worked in this space. We had a real push towards greater integration between employment and skills. There's now it's now a much more fragmented system. Again, some combined authorities are able to do this, but it's challenging in more rural areas that aren't covered by combined authorities. And this is where I think effective local wider local devolution is important, because it also links to housing, schools, health services. What are the things that will keep people in areas and attract people into areas? And then also, how do we align skills provision through colleges and training providers with the demands of employers? So skills boot camps is a great example of this, but it's not particularly employer responsive. So how do we make sure that the funding is following need, the funding for adult skills provision is following need, employer need, and we can link it up with supporting people out of work to get those jobs. We don't do it very well here. The US has some great examples, career pathways models that try and support entry and progression in work into better skilled work. Yeah.
Thank you, Chair.
Thank you. Sinead.
Yes. Just in terms of the linking up the skills with the employability and employment support, and one of the things we have done through our labour market partnership, actually regionally there are 11 labour market partnerships in Northern Ireland, and one of the big things we do is employment academies, and it is the skills boot camp idea. So they tend to be sometimes longer but short, sharp interventions that are directly driven by employers. So, and it is directly the skills that the employers need. So we resource the skills to meet those exact demands. So, and actually one of them, and that is quite nuanced depending on the labour market that each labour market partnership operates within. So in Belfast, we would have maybe 28 different variations of employment academies. And that could be from childcare to fibre splicing to tech. So there's a whole kind of rafter and range of them, but they're all driven by employment demand. And they're actually very good jobs. So one of them, for example, working at sea. So it's people working on ships. And the starting salary is £33,000. Now, our investment per person is something like £2,000 for the technical licenses and training, and that works all over the UK. So you can do it when you'd evolve it down to a city level or, a smaller region. The intimacy we would have with our employers is really high because we do sit within economic development. So it's the connection directly between skills and people and jobs. And if you offer people good jobs and access to really good work, you will get people interested who are economically inactive. It's about offering real opportunity for them. Interestingly, so some of my colleagues who work across rural areas, because I'm in Belfast, which is very urban, Another thing they're looking at within their local labour market is working from home options, so that people stay in their local areas. And I suppose the reason why I'm saying that is certainly for us, our labour market partnerships in Northern Ireland, we're intimate within the supply and demand space. So with the people in our areas and also with our labour markets, to really look at innovative solutions to it. So it's not about solving economic inactivity, it's about accessing good jobs for people.
Thank you, Sinead. We'll be interested to hear more about that Northern Ireland model. Just when were the labour market partnerships set up?
So we began developing them in 2020, but in 2021, they really were all set up. And it is a government initiative, so the Department for Communities in Northern Ireland lead on it, but it's a cross-departmental regional approach as well.
Thank you very much. Desmond Swain.
Thinking specifically about the extent to which mental health issues are work limiting, how would the devolution of services better enable people with mental health problems to find and stay in work? In any order. Well, don't all speak at once.
Well, look, I'm really happy to go first. I mean, so I think it's worth. I mean, this is an interesting one because I think it's a reminder that when we think about devolution, we don't necessarily mean devolving funding, power, and control to an individual local authority to run services, because of course they don't have control over talking therapies in the NHS. You know, those are run by NHS employers. They may or may not have control over skills support. They may or may not. They'll have very, very little leverage over local employers and what employers do. But the rationale for devolution there, I think, is more about that ability to join up more effectively and to bring services together better and to engage better with and to be able to be sort of closer to service users and closer to people and delivering services through the kind of public services they're already engaged with. So the Work Well initiative that was announced yesterday, I think, is a really, really good example of that. I mean, you know, it's a great idea. So to my mind, so integrated care boards in England were invited to submit bids to run these local services, and the intention would be that and in partnership with local authorities in almost all cases. So the intention would be that by bringing together local authorities and health services, you can have better quality conversations with GPs to encourage referrals earlier. You can build pathways from talking therapies where those are available and other mental health services. You can engage better, but also you can go beyond that. You can hopefully talk to employers too, because you start to get some of those economies of scale, or you get some of that clout by having more partners together around the same table and doing that at a sort of functional economic area. Got local authorities using the levers and leverage they've got with employers, using their own role as employers. The NHS is an important employer, and has its own challenges around mental health and stress and well-being at work, and other services. So then what role does Job Centre Plus play in that? And frankly, it's really patchy. Like, Job Centre Plus will be engaged in a lot of those Work Well partnerships. I'm certain they will, and they will have things to bring. But will they co-locate services in job centres? Well, of course they won't. You know, there won't be an ability for a health service or a skills service or a local authority service to have a desk in a job centre. It won't happen. Will they outsource into GP services? Maybe. It'll depend on where that's happening, how it's working. Will they flex some of the provision that's being delivered locally? Probably not. You know, a lot of this is nationally contracted provision. So I think by devolving, you've got devolving some of that localisation, some of that joint working, and some of that managerial flexibility to do things differently. We can have much better alignment between different services, and we can hopefully then deliver better services. I would say on the mental health and work piece, though, just a final point on this, work is incredibly protective and supportive of our health, and for most of the time, for most people, you know, work helps to keep us well. And so when it goes wrong, it can go very badly wrong. But work is a real opportunity as well. You know, making workplaces more supportive of well-being is a real opportunity, and helping to address some of the drivers of poor health at work, which often aren't related to access to occupational health. They're related to management, relationships, control. That's, I think, a fundamental bit, which I think is missing a little bit from our strategy at the moment. What is our strategy? How do we engage with employers on this agenda? How do we hold them to account a bit better than just having arguments about sick notes and statutory sick pay? How do we try and improve working conditions, quality of management, relationships at work? We don't have answers for that, but it's an important area.
Just one point to add. We funded the Resolution Foundation to do some work on young people's mental health, and I think one thing that echoes something we've said already, when we looked at young people with health-related activity, but particularly mental health driving a lot of that it was very strongly linked to education. And oftentimes, majority of people, young people, I think, who were inactive for health-related reasons, had qualifications kind of below degree level. So again, echoes that point that the link between health and education is important there. But I would really just reinforce the point that Tony said about access to work and good quality work. And I think also kind of early intervention, if people are at risk of moving out of work, which again Work Well seeks to address to some extent, we know that's really important. And also then I think recognising that mental health conditions can fluctuate. And I think that creates some particular challenges both for the individual and for the employer. And again, if we can think of ways that support can be available to can respond to that fluctuation conditions, I think that's really important too.
Yeah, I'll just echo comments on Work Well as being a good example of a quite innovative, devolved programme that is seeking to provide people who are in work with earlier support to prevent them leaving work in the first place. And we were really pleased to see the government announce that. We did some research looking at people in their 50s and 60s, and pointed out that once people in that age group leave work, they are quite unlikely to return, and their outcomes on kind of traditional employment support programs are often not particularly good. And just bearing in mind mental ill health can affect people of all ages, that the kind of Work Well model, providing support to people while they're still in employment or as early as possible, is definitely a good thing, and pleased to see the government announce those pilots.
So if we take the devolution of aspects of employment support via Work Well or also universal support, I think we've touched on quite a lot of the challenges there. But what do we have to put in place to ensure that those initiatives are successful? What will make them work?
I'm really happy to go first again, but I think those two initiatives kind of get to the heart of quite a lot of the trouble we've had around kind of devolving in the employment space, but also more generally, is we tend to devolve in silos with individual initiatives. It's not always really devolution. Sometimes it's kind of delegation. It's giving a combined authority the opportunity to deliver the same programme that's being delivered nationally, but to commission it themselves and make a few changes on the specification. Work Well goes beyond that, and so does universal support. Universal support is quite a radically different model, but I think we've got concerns about the pace, the time it's taking to roll that out. But that's about trying to push more funding and control down. But again, it's in a kind of siloed, programmatic way. The opportunity longer term, we think about devolution, would be to say, could we get to more like the model in Northern Ireland, which in turn echoes the models in places like Denmark, Canada, the United States, some other countries, where you have clear accountability. So what needs to be in place? Accountabilities between national and local, a set of national objectives, and then clear accountabilities then for locally how services will be organised and delivered. Clear ideas about where services sit, and then funding for commissioned services, for example, being pushed down to more local levels with less prescription around commissioning a particular service in a particular way, more opportunities to commission based on local needs, but against a set of national priorities, national objectives. And then you've got a set. So Professor Dan Finn gave evidence to the committee, and this sets some of this out really well. Alongside this, you've got challenges around how do you raise performance of programmes, or performance in areas, I suppose. How do we ensure kind of consistent quality of delivery? How do you build the capacity and capability for effective management and delivery of services? That's a very different role for the department. And also, how do you ensure equity? Well, you can't ensure equity sort of perfectly, but do we need kind of underscoring that? Do we need some guarantees, clear kind of service levels where people will have entitlements to support, even if the particular services might be commissioned differently? So for where we are now, I think we can run these as kind of top-down programmes. That's what will happen. But not top-down programmes. So we delivered locally, but they'll be managed as a Work Well initiative, as a universal support initiative. I think the opportunity, in the coming years, would be to get to more of a kind of labour market agreement, labour market partnership model, similar to what's happening in Northern Ireland, where more of the funding is pushed down, and where there's clearer national and local accountabilities then for performance, for delivery, for quality management.
Just to kind of, I think, again, probably echoing some of the points, but we've been running a programme working with a series of local areas, Economies for Healthier Lives. And I think that what that has shown is that we need to recognise as well that it can take time to set these partnerships up. And it's quite ambitious to bring services together, but it can take time. It can take time to build in the buy-in from local leadership. I think some areas will be better placed in terms of where their partnership working already is, or how well some of those geographies combine and overlap. But I think some places will be in different places. I think it does take time to set up, though. I think we need to recognise that. So I think sustained investment is really important. I think these are promising initiatives, but probably what we've seen, if we take a step back, is there's been quite a lot of churn in this space and quite a lot of different initiatives. So I think sustained investment is important. And then the other thing probably to note is that important to learn what's working well, but also to scale that up and roll it out, I think, in a kind of timely and effective way so that it can reach a wider population.
Sinead, do you want to add anything?
Yes, so all of the above, I have to say. It is. So kind of national and local can also work together. So certainly within our labour market partnership, we have the condition management programme, which I'm assuming is fairly working well. Yeah, Tony's nodding his head. That is a regional programme, and it's about keeping people in work. So it's a health-led, so it's funded by the Department for Communities, so the benefit system. So that big department, so DWP would be the equivalent of it, but it is delivered within the health trusts, and that's fairly important. So it's a purely health-led to keep people in work, but they're a member of our labour market partnership. So labour market partnership is about bringing all of the services and all of the strategic thinking, employers, the voluntary and community sector, the advice sector. So it's bringing government, Harbour Commission, so it's bringing it all together to look for joint solutions, and that joint upness is extremely important. So not all of it, actually, the money doesn't all need to be resolved. And I just want to say, just to echo if things are short term, we went into our labour market partnership thinking we need to have a 10-year strategy for doing this. We need to mean this, regardless of the resources that come with it. But resources are needed, and you do need a long-term strategy for it. And the kind of fit starts of initiatives starting and ending is never good for any local labour markets and the people who live in our area. So that long-term approach is really, really essential.
Thank you very much indeed. Debbie Abrahams.
Thank you. Good morning, everyone. I want to just pick up on a few points that you've made in the previous set of questions. So, Tony, I think you're absolutely right in terms of what you're saying about most work being good for you, and the importance of employers taking a sort of preventative approach in that. Is there scope, do you think, for employers actually to provide employment support formally?
So this happens in some ways already. So there's a fair amount of use of employee assistance provision and occupational health support. I think we've got reservations. Many people who've experienced it may have reservations too about whether that's always kind of focused on kind of rehabilitation. Sometimes occupational health provision in particular can be, people can be quite nervous about accessing that or may not want to. There's also been some, I think, challenges around the delivery of employee assistance programs in sort of recent past, in similar, in terms of being able to recruit sufficient staff and deliver services of a sufficient quality. So there is some of that where people have a work limiting health condition or where they're at risk of leaving work. In good workplaces, you'll often be able to access that. The rationale for kind of work well to some extent is to kind of recognise that this isn't happening everywhere, and we need to. I mean, some of this goes back to the 2008 Carol Black report, Working for a Healthier Tomorrow, which really we could almost still be there 15 years later, set this out, and was the reason why the Fit for Work service was introduced and then subsequently discontinued. So I think there's going to be a role for employers, and good employers will do this, and there'll always be a role, I think, for health services as well. And part of the challenge is where those boundaries are. I think, though, what role can employers play in engaging with people who are potentially outside the labour force entirely to support entry into work? I think this is a really interesting, important area we need to explore more. And we talk quite a lot to employers at Institute of Employment Studies. We work a lot with employers. And in general, where employers are thinking about is how do we widen access to our jobs, and think about in the context of talent and talent acquisition. They often think about how they recruit, how they advertise, and so on, and to some extent how they design jobs. Well, the challenge is most the people who are economically inactive, by definition, are not looking for work. It doesn't matter how you advertise it. If people aren't looking for work, they're not going to find it. So I think we need to also explore creatively about how employers can engage with local partners, local services, to get out and talk to people about work. And this would tie in really well with social value broadly around the role that employers are playing. It would make them much more likely to win public contracts for a start. But there's any number of things we could do around, for example, offering to mentor or support people who are outside the labour force, offering to provide kind of advice and coaching and so on, offering to engage or offer work placements, work experience. And that stuff, it's really hard to do in a very centralised system. And local government doesn't have the money to run those schemes. DWP, it would depend on the whim of a minister wanting to do it. I think in a more devolved system, if we could get better alignment with what employers are doing too and how we engage with employers, we'd be much more scope.
Thank you. So on moving then on to my second, and you've actually touched on it already, you mentioned about how it would be difficult for GPs or members of their team to be actually at job centres, but we already have welfare rights provided by many GPs. So is this possibly an extension that might be considered? That in addition to welfare rights support, you would also have employment support? Is this something?
Yeah, look, I think absolutely, because I think in a more co-located employment service, you would have more opportunities to do that in the employment service. But I think you'd also, in a more devolved system, have more opportunities for employment advisors to locate within health services and other community services, definitely.
Anybody want to add to that?
Maybe just a reflection on what we're asking of employers. Obviously, we said at the start there's a lot of variation between different areas and health challenges and the level of those. So I think what employers are, what we're asking employers will vary as well. And I think probably just to recognise, I think whilst employers can do more in lots of areas, I think line management comes out is really important, particularly around mental health issues that's come up in a lot of conversations I've had with employers. And research as well. I think that's important. But I think it's that kind of reflecting on that the context will make a big difference, and that access to health services, broadly speaking, we know is a kind of challenge. And I think, again, anecdotally from employers recognising that they might want to refer people into other health services and that, but actually there's kind of challenges in the wider environment.
Okay, Andrew, do you want to?
Yeah, I think integrating health and employment support is definitely a really good approach to take for people who have work-limiting health conditions. And I would point to individual placement and support as one of the sort of best evidenced programmes of that kind. It offers support to people with usually kind of severe mental illness, and it's had a number of randomised control trials which have shown that it's much more successful than standard employment support programmes. And the part of the concept of that is to join up the health support and the employment advice together in a more integrated way. It's currently funded by the NHS, so it's run very explicitly on the health side, but definitely that kind of approach I think is really positive.
Okay, Sinead, do you want to add anything on that?
Yes, so I know that other cities would do this, but in terms of from an employer perspective, one of the things that we've implemented over the last number of years is called Belfast Business Promise, which is our inclusive growth city charter. So like Manchester would have an employment charter, so it's fairly similar. So in terms of employers offering inclusive recruitment practices and offering good jobs, so we have real living wage, no inappropriate use of zero-hour contracts. So it's kind of challenging our employers as well to be inclusive in terms of their workforce. So yeah, I think that is certainly one of the levers that we would utilise really in the city to do that.
Thank you. That was my preamble, so I'm going to come on to my substantive question now, so I don't annoy the chair too much. I just wanted to understand from yourselves, and perhaps we could start with Andrew first, because you mentioned in terms of the evidence base, and I think there's it's important, isn't it, really, that if we are going to invest, whether that's DWP or elsewhere, going to invest in these programmes, there needs to be an evidence base. And this is the difficulty, isn't it, between national programmes where you have critical mass, you're able to evaluate and so on, and smaller programmes where you might not necessarily have that evidence base. So I wondered if you wanted to comment on the pros and cons of further devolving of that. I don't know, Andrew, if you want to start first.
Yep. So definitely it's important to have a strong evidence base to make decisions about what kinds of employment support are funded and which models are more effective than others. And I don't think devolution of employment support means we need to give up on evaluation. So I think it's perfectly possible with the right design to evaluate devolved programs or schemes. I think my slightly wider thought on it specifically is that there is a degree to which simply evaluating individual program by program is quite a narrow way of thinking about how effective employment support is in a local economy or a combined authority area or a local authority area, depending on the region, because what you may not capture by looking at simply the individual program is the integration between services and how well are those joining up. And I know from speaking to practitioners on the ground delivering employment support that currently in many areas there's a kind of baffling array of schemes provided by numerous different organisations, which makes this very complex landscape. We described it as a tapestry of services in our report, and I think in thinking about evaluation and accountability for devolved systems, I would like to see a move towards looking at wider systemic outcomes, things like employment, productivity, earnings, employment for different groups, and so on, so that to join up those services, to encourage those services to join up rather than having so many individual programs that we try to evaluate in a kind of siloed way.
Okay, I was just going to make the point then, don't you need yes, you can have your evaluation on your outcomes and so on, but you need also a process evaluation to understand what those bits, whether it was the partnership working or whether that worked effectively, whether it was the integration with employers and so on and so forth. So I suppose the point I'd like to make, I don't know if you agree, is the importance of the evaluation, whatever programme that's undertaken. Okay.
Yes.
Yeah.
Both and.
Thank you. Anybody else want to add to that?
Could I just add? So we find our evidence base is really, really crucial to us. And there's 11 labour market partnerships in Northern Ireland, but we're flat out talking to each other. And what we do, others can scale up if it works well. So there's really simple things that we have done. For example, we set up a framework to deliver our employment academies. Other councils can actually draw from that framework. So they're drawn from the same model. We have created through a project we've done with RSA Cities of Learning around digital badging. What we've found is that the app that we use to do that is providing us with a really solid evidence base of every single person who comes in through our programme in terms of their any characteristics, whether or not they're economically inactive, they're out of work, they're kind of the working poor. So really gathering all of that. In Northern Ireland, it's called Section 75, so quality monitoring. It can look at evaluating the impact on the individual in terms of their soft outcomes, in terms of how employable they feel. It measures them into work. It measures them 6 months later into work, what their salary level is. So that evidence base, we actually have it. And once one labour market partnership kind of creates something that is really solid, the others can kind of take that practice on. And certainly the Department for Communities, which effectively owns labour market partnerships, although it is cross-departmental, they're actually looking at that to bring in for all labour market partnerships. So local and national can interact and work together. And don't ever think because something is devolved that it won't have a really solid evidence base. Do you know, our employment academies, for example, one of our interventions, if we're not getting 75% of people into work through them, then we're doing something really, really wrong. So it's in our interest to really look at how we can always improve it as well.
Yeah. So I think that's a really good point, Sinead. Is there anybody who hasn't?
Just to add a couple of quick points. So one, I think, is you're absolutely right. We need to kind of evaluate the implementation of and the delivery of services as well as the outcomes they achieve. And there have been evaluations of devolution internationally, devolution in Denmark, in Canada, and the United States. And some of that does appear to find positive effects from the process of reorganising services, doing things more locally, joining up effectively. But it's contested. It's really hard. We can't run these things as randomised control trials. It's always people always argue whether it's right or wrong, right or not. But I think part of the challenge is that we tend to start from a presumption of prove that you can do it. It's very much kind of earned autonomy model. You need to prove that we're better if we devolve, which I know isn't what you mean by the question, but it's how a lot of that devolution happens in how DVP does it. It kind of feels like we could maybe start from the alternative and say, actually, we think there's intrinsic value in delivering services more localised and better. So let's test this and try and evaluate it effectively and try to learn from it. And I think in the long term, though, if we did have a more devolved system, perhaps along the lines of Northern Ireland, because Northern Ireland is really interesting. Well, I know we'll come on to it, but the equivalent of Job Centre Plus is run by the Northern Ireland government, and then local authorities have a lot more local control. So it's a mix of devolved and central in that respect. If we got to a model more like that, it could point to a very different role for DWP, and I think that's a really important role. To have more of a stewardship role, a role where they were enabling and supporting local commissioners to understand what works, so they can commission more effectively. We're then helping to give them the tools to evaluate more effectively, but we're also holding them to account for what they achieve and potentially looking at the quality of services. We have no equivalent of Ofsted, of the CQC, there is no independent quality for employment services at all. It's more about the only public service where there isn't. If we have more of that approach to kind of quality management and stewardship of the system, I think we'd get much better results, and we'd improve the capacity and capability of the system. And that is what happens in other countries. That's exactly what happens in Denmark. In the US, there's amazing online resources, clearinghouses for evidence that commissioners can use to understand what would work and what should we buy.
We were in the US last
yes,
year,
indeed.
Looking at that work. Christopher, did you want to add?
No, it really resonated with me. I think some of the work we've done of just really demonstrating of building capacity. How do you share learning across networks is really important as well.
Thank you. Thanks very much.
Thank you very much indeed. Selene Saxby.
Thank you. I know we touched on some of this in the very start of the session, but if there was anything further you wanted to add on if it was further devolved, along what boundaries should employment support be delivered? And in particular, would you use the same boundaries across different employment support provision, different boundaries for different types of provision or different regions? Any thoughts?
Happy to go first. So, in research from a couple of years ago, we proposed what we called a universal work service, which would provide a front door to careers advice, employment support skills for anyone who wants to access it. We think that could help simplify the current system where, especially for people outside the social security system, they don't necessarily know where to go to access support or advice. I run focus groups for people who would be in the target group for things like universal support. They have never heard of it. They don't know what's available. They don't know where to go to get some advice or support. So we said in that research that we think devolving the commissioning and the design of that kind of front door service to the combined authority level or the functional economic area level is the right kind of geography for that. And going back to some of what I said previously as well, and as Tony said, thinking about joining up employment support and skills, where combined authorities exist, they have devolution of the adult education budget, so there's an opportunity there to align economic policy making at the same geographical level. Now, obviously, there are lots of areas in England that don't have combined authorities, and so we need to give some thought to groups of local authorities, maybe individual local authorities, depending on the geographical area, but thinking about aligning those kind of economic policy-making functions of the same tier of government is the direction we think we should be going in.
Thank you. Is there anything anyone else would like to add?
I mean, obviously to reflect that it is quite complicated and the current landscape is quite complicated, is quite fragmented, that it probably will be different in different places. And for example, it'd be quite different in London, for example, than other areas as well. So I think there's a lot of complexity. I think you mentioned simplification. I mean, I think it would probably help to simplify it more than complicate it.
Yeah, and I think the point about trying to align with other approaches, how other services are being devolved or being better coordinated, is really important. A lot of that at the moment in England is happening at combined authority level. I think, though, there's no reason why some of this can't also happen at local authority level, and I think it should. And again, I think Northern Ireland's a really interesting example of this, because the labour market partnerships happen at the individual local authority level. Now, you may not in England push, this is where the distinction between devolution and localisation again is important. You may not push like funding and policy and commissioning and everything down to each individual local authority. That may not be appropriate in some parts of the country, but you would, I think, want to see effective local partnerships in different local authorities that are trying to bring the right actors together and join up services, and where you've got a duty to cooperate for the local job centre, to be around the table, to be engaged with that, to be offering to co-locate and thinking about how they can flex differently. And we shouldn't forget that the Shared Prosperity Fund was in effect devolved to every local authority. And one of the challenges was that some local authorities just weren't able to commission. Some haven't even used the People and Skills funding at all. Some haven't commissioned, in my view, particularly effectively, but some have done some great stuff, really innovative stuff, to very, very short timescales with very little support, because there hasn't been that kind of stewardship function to help them understand what they could commission, how they might understand their areas and so on. It's really been left to local areas with a little support, but largely left to local areas. So I don't think there's any reason why we couldn't do more of this at a local authority level, particularly where we have more rural or more sort of semi-urban or urban-rural areas where we would need more localised approaches. And it gets drowned out a bit in some. I've worked in some combined authorities too. Combined authorities have rural and less connected areas too, and often get disadvantaged by the focus on the centre.
Thank you. And if further devolved, how should funding be allocated to support employment services and providers?
So we're doing a commission at the moment with Aberdeen Financial Fairness Trust on the future of employment support, and so we're getting into a lot of these sorts of areas about how we might organise services differently and sort of national and local. And I think where we're edging towards, and we hope, and we've been consulting on proposals in the sort of next month or two, would be that for funding of employment services, the additional employment support programmes, but not everywhere the management of Job Centre Plus, that should be pushed down to combined authority level in England. And then where combined authorities don't exist, either we need to create the kind of functional economic areas to do that, or look at devolving to local authorities. And a lot would depend on what happens in the next Parliament more broadly about kind of devolution, I think, and about how those are organised. But even with that, I do think at the important point is then still at the local authority level is to have some control over how services are delivered in your area.
Thank you. And anyone got anything to add on that? Because my follow-up question is, how would then DWP ensure it was actually achieving value for money? Back to you, Tony, I'm guessing.
Well, so so I think this is where you do need a very different role for DWP, and I think they would have, their objections to it, I think, are understandable in saying that their view is that primarily, for most of what they purchase, they are purchasing things where they know what they want to buy, and they think they can define it fairly well, and it's a transaction, and the providers will offer to do it, and we can do it at a large enough economy, to get the economies of scale, and we can manage efficiencies more effectively that way. And I think they've got some good evidence that it can be more challenging to do those same things multiple times everywhere. So again, I think this is why you may not want to devolve the delivery. You wouldn't want to be commissioning Job Centre Plus in every single local authority. But in terms of commissioning additional employment support for disadvantaged groups, there's no reason why I wouldn't necessarily push that down. And then the value for money point, I think, comes back to the stewardship role for the department. So being really clear about setting the sort of framework within which we want, who are the groups who we're expecting, who are the beneficiaries going to be, what outcomes we're going to achieve, how we understand the counterfactual of what would have happened without the intervention, how we evidence it. And we've got a lot of the tools to do that. The data lab, the DWP data lab, is a great initiative which enables us to do some of that too. But it would mean a very different focus for the department, and it would be quite a significant change. They've got the capacity, they've got the capabilities to do some of this already, but not necessarily the capacity to do it at the scale that they might need to if we had a much more devolved system, if funding was more systematically devolved everywhere.
Thank you. Thank you very much, Chair.
Thank you. David Linden.
Thank you very much, Chair. I want to come on to some of the opportunities and challenges. So if we further devolve employment support, how does that impact the consistency of service delivery? And would there be any consistent factors which determine success? Maybe start with yourself, Mr. Rocks, if that's okay.
I think further devolving it, is there a risk of having less consistency? I think maybe one thing to recognise, others might be a better place to comment, but I don't think we have full consistency at the moment, that there is variation in how services are delivered and outcomes already. So I guess potentially there is a risk of having less consistency, but I think there's also opportunities to learn from that. I think it goes back to the importance of how you evaluate some of this, how you learn from good practice and how you spread good practice. So I would say there is an opportunity as well as a risk.
Can you just elaborate a little bit more about how consistent the national employment support provision actually is when it comes to delivery?
Not to go back to Tony, but I don't know, others might be a better place to comment on. I don't know if anyone else on the panel would be able to come on it.
Happy to come in and give my view. I think my summary answer would be that it is quite inconsistent overall. I think if you're unemployed and receiving universal credit or an equivalent unemployment benefit, that there is some consistency in accessing a job centre, and the kind of job centres themselves are quite consistent. Although even then, it's worth mentioning that job centre work coaches often refer people to other organisations locally that provide various types of additional support, and that looks quite different in different places, but depending on what kind of local programme schemes, organisations are available in that local area. For people outside the social security system, the support available is really inconsistent in the sense that, depending on where you live, your local authority might run a service where you can go and get some advice or support, but it might not. And there's an additional inconsistency in terms of people's variable awareness about what exists in the local area as well. I think there are good reasons for having different programmes in different places. We spoke about the advantages of flexibility already in the session, so I don't think we should be worried about inconsistency in that sense. But I think what we do need to think about is how do we make it work well for citizens, and I think particularly focusing on people who are outside the social security systems, people who are economically inactive, for example. And that's why what we propose is a kind of this universal work service idea where there's a single front door, which would boost awareness so people know that there's some advice or support they can get. And then that would be a kind of triage service that then would refer people and direct people to the specific programme, organisation, charity, whatever, that can help them in their local area.
If we end up in a situation where we further devolve employment support services, what role would you envisage that DWP would still have in order to ensure that there was a kind of base level? Does anybody have a view on that?
Well, I think there's different ways you could do this. So first, I think there should be a set of really clear accountabilities at different levels and a set of agreements which can govern that. These are the objectives that we're setting at a system level, a national level, and at a local level. This is how we'll achieve them. I think alongside that, there needs to be something which is more citizen focused, which is a straightforward guarantee that if you want help to get a job, you will be able to get help to get a job. And that just feels like something we should be able to say, but at the moment it isn't, because you can't phone up Job Centre Plus and get help to get a job unless you're claiming benefit, and even then it's only if you're claiming the right bit of benefit. So the arguments about consistency are fine to a point, but it kind of depends on you claiming the right bit of benefit, whether you'll get a consistent or whether you get any offer, actually. So you can have a base level of a kind of citizen's entitlement that you will be able to access some kind of support. Do you then go beyond that and say there will be a kind of an entitlement to individual placement support if you have a long-term health condition? Well, that's quite challenging. I mean, there's never going to be enough supply for everyone who might want that, but we could say that we can guarantee there will be access to specialist employment support for if you're disabled or have a long-term health condition. We might say we guarantee you'll have a caseworker if you're long-term unemployed. If you're unemployed for more than a year, we guarantee you will have somebody who will help you find a job, and you will see them regularly, and hopefully it will be the same person. So you can still set standards. Devolution doesn't mean that everyone can just decide what they want to do and just go and do it totally differently. We can still set standards within it, just as we do in other public services. But again, that role role for DWP then becomes very different, because they need to be the sort of police person for that. They need to be able to say, is this actually happening? But they also need to be the ones who are stimulating innovation, who are helping organisations commission better. But I'll tell you what, this is what local government, in my experience talking local government, this is what people want. They want more help on doing this. And DWP, I think, views devolution as a threat, whereas it's really, they could be the most important actor in a devolved system, because they've got such power to help organisations, help local partners understand what works, drive improvement, give people the tools to do it better, and hold them to account as well. And that's what Sinead, this is what happens in Northern Ireland too. I think it works there, and we have not everywhere's the same, but there's consistent services across the country.
Yes, and just to add, so we are also the public sector, so it's in our interest to ensure that there is a good standard of quality of provision. For example, we're bringing in Belfast, we're bringing our own quality assurance framework into the work of our of the employability and skills team within it. So, no one's making us do that. If that works out well for us and we kind of iron out the kinks, then we share it with all labour market partnerships across the region. So we commission all of our services, and I suppose we all want value for money, and I think if you devolve it, the local authorities, I don't see what the issue is necessarily. It is about setting, you do set a framework where there's very clear expectations, but also the labour market partnership, we kind of look at four things. We look at supply, so people, demand, employment, and then policy and provision. And we design and commission and deliver the services based on all of those things. So it's based on what currently exists in the ecosystem. So one of the things in Belfast we didn't have was that triage service that was talked about. So we set that up. And that's different. It's very, very different in a rural area. I wouldn't be able to design or deliver a service in a rural area. I don't have the background. I don't have the knowledge. I don't know that local labour market. But my colleagues and LMPs in rural areas do know how to do that. So there's a level at which there's a consistency of approach, but there also needs to be flexibility if you want to seriously solve issues around economic inactivity. There's a level at which it does need to be fairly innovative, and a place-based approach is okay.
And that quite helpfully brings me on to the next question I was going to ask, which was, Ms Abrahamson made reference earlier about the trip that the committee undertook to the USA. Last year we had the opportunity to see the Jobs Plus programme. I guess my question would be, how could local areas ensure that different types of support, such as housing, other skills, are best designed to kind of meet the needs of those areas? Can you speak a bit more to that, Ms O'Regan?
So one of the things we've done through the labour market partnership, so we look at where there are gaps in provision, and we can take risks in a way that kind of government can't. So to look at those big mainstream programmes. So in Northern Ireland, one is called Skills for Life and Work, which is the mainstream provision for 16, 17-year-olds who've left school. So our mandatory school age ends at 16. The outcomes from those are really, really poor. So it's the official outcomes is between 1% and 3%. So that was one of the big things we looked at within our labour market partnership, and we designed an intervention that was so tiny, but it was to bolt on the existing provision, that if we did something different and measured the outcomes. Now, actually, the outcomes were so good, and the money was tiny we put into it, and it was very needs-led, so we didn't say what it would be, but the young people in those programmes, the outcomes are really poor. What we found out was it was people not staying on the programme. So once they stayed to the end, it was all fine. So, and we were able to have a test and learn for if we put an intervention in that is genuinely based on the needs of those young people, would it have a positive outcome? Yes, it had a massive, massive outcome. Mostly it was around counselling and mental health provision. And I think sometimes it was just having the resources for those providers to be able to truly value a young person, that isn't about that hard edge kind of training. You're getting your level 1, you're doing this, you're doing that, which they're funded to do, but those additional things. So, but the purpose of us doing that is not to continue to do it. It's so that the mainstream programme can adapt and change to take account of the learning from it.
Okay, thank you.
I hope that answered your question. So that was just one example, but I hope that answered your question.
No, that's brilliant. I'm going to turn to Mr. Wilson now. I mean, how easy is it for employers to engage with employment support services?
So most don't. So we published some polling that we did over a year ago now as part of our commission on the future of employment support, and so we found that I think it was between a third and a quarter of employers who'd accessed Job Centre Plus services. But of those that did, most were pretty happy with their experiences of it. And I think that was probably, in part, maybe because they tend, you know what you're going to get, I think, if you do engage with Job Centre Plus. I think also, sometimes programs like Kickstart, for example, have been quite effective. Sector-based work academies work really well for employers. There is Job Centre
employers of a certain size.
Absolutely. And I think that's a really good point, because this is also, I think, the point about kind of where devolution fits, because I think there is a really clear argument for having a clear kind of national offer for employers, and employers of a certain size, kind of national management, those partnerships can be really effective. But day to day, most interaction with employers is local, one way or another, and it tends to be the local employer, even for a national employer, it tends to be the local managers you want to reach. And I think so even in a more devolved system, I think in a devolved system you would still have a national employment service, because another aspect is digital delivery as well. Most people will access, if you lose your job, probably the first place you're going to do is look on your phone or look at a computer. Once you've sorted out your benefit claim, it'll be on your phone. So having sort of digital front end as well. There are other arguments why you want to have clear kind of national services, I suppose, and this is one. But we can do much better around, again, devolving the day-to-day, the practicalities and the specific design of services for employers too, to more local levels, I think.
Okay, that's all. Does anybody else have anything they want to add to that section?
Can I just pick up that point that, Sinead, in Northern Ireland, if you're an employer recruiting across Northern Ireland, presumably in the past you could just go to the department which runs the job centres, but now you've got to go to 11 different labour market partnerships. Isn't that a problem?
No. So we did. So labour market partnerships join up with each other, and they can still go to the department. So it's not one or the other ever at all. And it's really, really important for us to work with the Department for Communities and to work with the Department for Economy. We did commission scoping on like a unified, we called it an employer navigation service. So could all the key players, so SNI, departments, colleges, ourselves, could we look at one hub? Because what we found out was employers were saying, and particularly smaller employers, so micro businesses, SMEs, it's all very, very complicated for them. And it's like a rabbit hole you go down. So if an employer is sitting there looking at, I need an apprentice, to go into that system, the attempt to find out is just a minefield. And it's a very competitive system. So everyone's competing for employers' attention. What we're hoping to do, certainly through our labour market partnership, and we are very new, but this is our ambition, that we kind of coalesce and create like an employer-facing, unified way that we present ourselves that can be regional, but that every labour market partnership picks up. So, for example, there is programmes at the Department for Economy, those big, massive employers, they'll sort themselves out and they work really well and they can interact with the system. But maybe it's for the SMEs or smaller employers that actually there needs to be one unified voice and service for them that is like a triage to find out the right provision for them. And that's what we're hoping our service will be. And it means we're not talking to, it's not even 11, it's probably about 30 currently, because every college, every government department, everyone's competing in the same space. But because we're slightly outside of, we're a neutral broker in that space, we can kind of see things from a really, really different perspective to look at what are the solutions to that.
Thank you. I think David wants to come back. Sorry.
Yeah, thank you. Just a kind of, I may have missed this earlier, Ms. Regan, but you mentioned, so there's 11 LMPs. Roughly
Yes.
How many kind of people do they kind of cover? Is that kind of on a local authority basis?
It's local authority based, yeah.
Right, so it's 11 councils.
Yeah, it's 11 councils, and the resources, the funding for it is proportional to the population size and deprivation level. So all LMPs do get different resources. But it is a regional approach, so it's owned by the Department for Communities. They also own the benefit system, but other government departments sit under regional labour market partnership, and then all 11 councils. And we're a small part of the UK, so our population is like under 2 million. So Belfast would be the biggest, so our population would sit around 400,000. So some of them. So it is, yes, it is on a local authority level. We are flat out speaking to each other, I have to say, and we do organise ourselves through infrastructure like Solace, which is all 11 councils regionally coming together. So, yeah.
You won't be surprised to hear as a nationalist MP that I happen to think small is beautiful and more devolution is a good thing, but we'll leave it at that. Thank you, Chair.
Thank you very much. Sinead, just before we finish, can I ask, so if I'm working in a job centre in Northern Ireland,
yes,
how has my work changed because there's been a local a labour market partnership set up in the area?
I suppose, so in our relationships, so the job centre, we call them jobs and benefits offices, so the equivalent to Job Centre Plus, we work very, very closely with them. It is about adding value. It's not about duplicating. So our number one is, and we have principles that we work to, do not duplicate. It's about joining up. So we meet with all of our jobs and benefits office. They sit on our LMP, and we meet with them operationally every single month. So we co-plan and co-deliver like localised job fairs or, citywide job fair. So we do plan with each other, and it's about joining up those opportunities so that, if we have an employment academy, any part of any provider in the city, including our jobs and benefits offices, can refer people into those current opportunities. And we have like a provider network with about 400 to 500 kind of people who are on that. So they're a critical partner, and it's about the recognition of none of us can do this on our own, and that you have kind of parts of government that will only be interested in their programme. So the skills people, the employment people, and it's about breaking out of, don't just look at your own. You need to actually look over here. You need to look at demand, or you need to look at supply, or, what is the provision in the city. So, yeah, all of those are kind of critical for us.
Good. Thank you very much indeed. That concludes our questions to you. Thank you for a very interesting session. We're grateful to you all. Order.
The proceeding is currently suspended. 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 The proceeding is currently suspended.
Order, and welcome everybody to the second session this morning in our evidence session, the first that we've had in our inquiry on the devolution of employment support. A warm welcome to the four witnesses joining us for this second panel, and can I ask each of you very briefly to tell us who you are, starting with Ben Gadsby.
Good morning, thanks for having me. My name is Ben Gadsby. I am Head of Policy and Research at the charity Impetus.
Thank you. Anna Shiel.
Good morning, and thank you, Chair. My name is Anna Shiel. I'm Chief Investment Officer at Better Society Capital, formerly known as Big Society Capital, and we are an independent organisation whose mission is to grow the amount of private investment tackling social issues in the UK.
Thank you. And joining us virtually, Professor Jonathan Payne.
Hello, I'm Jonathan Payne. I'm Professor of Work, Employment and Skills at Montfort University.
Thank you. And Pegs Bailey.
Hi there, I'm Pegs Bailey. I am the National Third Sector Employability Partnership Engagement Manager, supporting devolution or engagement of the third sector in devolved employment services in Scotland. And third sector interfaces are like your equivalent of voluntary council services, I think, in England. So.
And are you in Edinburgh, Pegs?
I am today, yes. Thank you.
Okay, well, thank you all very much for
Sorry
joining.
to hear that.
Glasgow this afternoon, David, so...
So the first question I put to you is this. I wonder whether each of you can tell us which groups of people you think need the most support to enter, stay and progress in employment. Who needs the most support? Starting with Ben.
Impetus, we commissioned some research looking at the Leo data a few years ago called the Youth Jobs Gap. The main finding from that was that young people from disadvantaged backgrounds, so socioeconomic disadvantage, were about twice as likely to be NEET as their better off peers. About half of that is due to qualifications and half of that is due to other stuff, which I must admit surprised me slightly. I had a sense that kind of qualifications were going to be a big protective factor, and they are, but it's by no means the whole story. And we also found significant kind of geographical variation. People often talk about this stuff in terms of kind of regions, but actually we found really significant variation sort of between local authorities, within regions and within combined authority areas. And when we speak to people from local authorities, they tell us about the kind of the different challenges they face within different places within their local authority. So a real focus on kind of very granular sort of local differences.
Thank you. Anna Shiel.
Thank you. I should say I'm really speaking in my capacity as an investor in something called social outcomes partnerships, which are a model where government only pays for the outcomes for the individual once they're delivered, rather than a more traditional fee-for-service model. So you've heard from many of the experts around the nature of the need, and I certainly won't try to sort of match their level of expertise. But what we have seen is that social outcomes partnerships can be a powerful tool for supporting individuals who have more complex needs, who might fall through the cracks of more standardised programmes of support. And some of the sort of types of individuals that we've seen that may be benefiting from social outcomes partnerships can be young people exiting care, or indeed young ex-offenders, people facing mental health challenges, and also people experiencing homelessness.
Thank you. Professor Payne.
Yeah, I think people who tend to have complex needs and multiple barriers, so people with disabilities, whether they're physical or mental, people with low education, low qualifications, substance and alcohol dependency, mental health problems, domestic abuse for women, a whole gamut, a whole range of complex needs which tend to be related to multiple deprivation. And they need a very particular model of support that's very tailored to helping them access the labour market. And this group as well, unlikely to reach out to mainstream services. So a lot of outreach work needs to be done to get these people to engage.
Thank you. And Pegs Bailey.
Yeah, and not really much to add to what the others have said, I suppose, other than to, given as this is in the context of devolved employment services, to reflect that the people that need most help will vary significantly depending on the area. And the help they need will vary significantly depending on the area as well. So in some areas, it might be to do with lack of actually accessible jobs, not necessarily a lack of ability within the individual, or it might be something around that intersectionality of really complex barriers. And that requires much more of an integrated support response, not just a traditional kind of, if we give them, some confidence building and a CV and some interview skills, then, tick, job done, we'll get our job outcome, but actually something which is much more rounded, much more personal and much more adapted to whatever is happening in that particular area. So, which is where sometimes more of the traditional numbers in, numbers out approaches to employability might not work so well.
Thank you. Desmond Swain.
What's special or even unique about the ability of third sector organisations to reach those who are furthest from the labour market?
I'm happy to step in on that. I think there's a number of things which third sector organisations bring. I think firstly is actually their willingness and ability to work in partnership in local areas. So to bring together often the best of the range of support that might be needed around an individual. So taking a sort of individually centric approach to their needs and then building around that and bringing a partnership together. Clearly there are a number of third sector organisations that have deep expertise in working with some of the groups of individuals that we've talked about, whether that may be people who've experienced domestic abuse or who have other challenges. So they're bringing that expertise to bear. I think the third thing that they can bring is that local knowledge and context and understanding, which both helps form those partnerships, means they understand what might be needed locally, what might be driving the challenges for the individuals, but also what some of the solutions may be. So that allows them to actually deliver potentially more flexible, more tailored services to individuals based around the needs and actually also the strengths of those individuals. So sometimes taking an asset-based approach to those individuals' needs.
Does anyone want to add anything to that?
Yes. I'd like to come in if I can.
Go ahead.
Yeah. I mean, at De Montfort University, we undertook a survey of third sector providers, and we got 64 responses from organisations, some of which support hundreds of thousands of people every year. And it's interesting to put some numbers on this. So 86% said that all or most of their users have complex needs. And we mentioned those. So that suggests that they really do reach this client group. Their particular way of working, 9 in 10 said that they work with users to identify barriers to employment before looking at a job. So really delving into those barriers first. That they work with the users at their own pace to support their own choices. And that's really important. 9 in 10 said that. And that they support users into work that's sustainable and right for them, given their choices. Also, their effectiveness comes through in the survey. So a third stated that they get most of their clients into work during the lifetime of their organisation. And a further third get between a quarter and a half of their users into employment. So they really are quite effective organisations in terms of helping this client group into work. And the final point I would make is that the holistic approach that Anna's just talked about is really important, because almost all of the respondents to our survey said that they feel that the mainstream employment and skills support models just aren't suitable for meeting the needs of their service users.
And carry on.
Peg wanted to come in.
Sorry, yeah, could I just add a couple of points? I think so. We've had devolution to local authority and local employability partnerships in Scotland for about 4 years now, and it's been happening in the area that I worked specifically until I took on the national role in Fife for 10 years through various different means. And I think a couple of things that we've identified as being really important with the third sector partnerships that we have in place is it acts as a trusted intermediary. So for a lot of those people that you are looking to reach who are further from the labour market, who have maybe been out of work for a long time, or who are young people who have disengaged from education, your more traditional job centres, your more traditional even local authority delivery, your more traditional kind of official systems and processes are quite off-putting and not places that they would necessarily go to seek support other than their benefits, if they're claiming them at all. People are coming up against and working with third sector organisations in their community through gardening projects, through health support, through housing advice, through drugs and alcohol support. And as those organisations have then built up trusted relationships with those individuals, they are then beginning to have conversations with them around these other parts of what might become a very important part of their journey to becoming a contributing member of society, if you want to call it that. So I think there is a really important point around that trusted intermediary role that third sector organisations play, and that they are quite often working in spheres which are not just employability. And I would say that if you look at your traditional current systems of commissioning, or some of the more previous systems we've had in Scotland, quite often we saw those larger national scale commission provision or regionally commission provision still relying on these smaller organisations, but these smaller organisations never getting any funding or support or recognition for the role that they were playing in these, and larger organisations kind of, we might say, perceived as taking the money and taking the credit for others' work. So, yeah.
What estimate have you made of the current mix of locally as against nationally commissioned services, and what impact would greater devolution of services have on the third sector? But don't all speak at once.
I can talk to the experience in Scotland, if that's helpful. So in Scotland, everything's now devolved through local authority and local employability partnerships. That has, and I think to speak to a point somebody made earlier, in areas where there are established partnerships, that has worked really well. So and there is a really sort of thriving and dynamic local provision. There are risks and challenges because every local authority is politically very different, oriented partnership-wise or internally. And so I think there's a lot of very interesting lessons to be learned around doing this work at scale and those points of accountability and transparency. But to answer the question around, so for example, in Fife, it was 70% of the employability provision was delivered through third sector organisations. In Scotland, nationally, I couldn't speak to the whole balance, but certainly a significant proportion, I would say over 50% across Scotland, but that varies differently by local authority, is commissioned out to third sector providers. And the level of delivery is looking really positive in those areas where that's happening. But it does vary significantly, and I think that's where some of those kind of accountability measures are probably really important to have in place.
And what are the main challenges, financial challenges, funding challenges for third sector employment services providers? How can it be improved, and how might it be affected by greater devolution?
I'm happy to come in on that.
Well, Anne, you go first, and then we'll carry on.
So I'll touch again on social outcomes partnerships and that model of contracting and commissioning, which is based on outcomes only. So that can be hugely positive because it essentially empowers those third sector organisations to deliver the tailored services. It can make it about the individual. They don't have to deliver a very specified programme of support to the individual. And there's evidence that can provide better outcomes for those individuals, as well as actually better outcomes for government. So we've evaluated some of that. An independent evaluation found that for every pound spent by government, there was £10 of social, economic and fiscal value, and £3 of that was direct fiscal or cost saved. So it can be a really beneficial way of arranging partnerships. But one challenge it creates for the third sector organisations is that they are only paid if those outcomes are delivered. Now, for large national organisations, they may be able to absorb that risk. For smaller local organisations, that's not something they can necessarily absorb, and they could potentially be precluded. What social outcomes partnerships therefore bring in is socially motivated investors who provide the upfront investment to allow the services to be funded, and then are participating the risk, and they're only paid if the outcomes from that particular programme are achieved. So that's one way of, I think, empowering and enabling more local third sector organisations to participate in the delivery of these kind of programmes. There are additional challenges that I think have been touched on around the fact that they are often integrating multiple different funding streams and different services and having to deliver for individuals across those, and that can be complex. Some of these partnerships that we've seen have actually been able to bring some more of those together over sort of multi-year periods in order to design the kind of, again, more bespoke, more tailored services that are needed for individuals with complex needs. And something that central government has done to support that has been the creation of what we call central outcomes funds, which act as co-commissioners alongside local government or other local commissioners. So that is, again, giving some confidence to the local commissioners to adopt this approach, but it can also reflect the fact that some of the benefits of this may accrue centrally and not always locally.
There was someone else wanted to have a go.
Yes.
Yeah.
Yeah, I just wanted to say something about what should be devolved and what should be done nationally. What comes across very strongly through the interviews that we conducted is that most people seem to argue that you need a blended approach, that you need some kind of nationally commissioned programs that can deliver at scale and that you can evaluate the impact of. But they're only going to work for those individuals that are closer to the local labour market. And you need local, trusted grassroots organisations offering specialist support to get at those with complex needs and multiple barriers. So the idea is you can't have one or the other because people's needs are so different. So you can't devolve it all nationally. You can't also, you can't do it all nationally. You can't have one or the other. You've got to have a mix in order to get this right. And picking up on what Peg said about Scotland, you know, a lot of the interviews we've conducted are really extremely critical of the devolution of employment support to local authorities for a whole host of reasons about the lack of transparency, the lack of accountability, the lack of funding getting out to the third sector, because some local authorities have become a black hole, sucking in funding for their own teams to protect their own staff. And a lot of the interviews are quite positive about the nationally commissioned programs, like the Employability Fund that was commissioned by Skills Development Scotland, because they saw it as much more transparent, fairer, and effective. And so I think there is like almost a juggernaut movement towards localism and local authorities, but we need to lift the stone and lift the lid on that a little bit and understand some of the problems that go along with it.
Could I come in on that as well, on the point, I think, of the funding? And I think some of those points that Jonathan's made, I probably don't agree with all of the interviewees, but I do think there has been, I think there are things that can be put in place if one is taking a devolved commissioning approach, which would help mitigate some of the challenges which have happened. And I think one of the issues is every single local authority in Scotland has taken a very different approach to commissioning, and some of the money has been given to people within the local authority who have no experience of commissioning employment services ever before. So if we understand that what you're talking about here for England and Wales is actually a very large culture change programme, and so if one is looking at devolving decision making to local employability partnerships or local authorities or regional authorities, wherever it might be, there is a significant set of skills that people need to have in place to do that work well. And some of those skills are around understanding commissioning, and some of them at scale, and around governance at scale, and some of them are around partnership working as well, which isn't always a matter of course in every area. So yeah, I think there are organisations that have said that they would prefer there to have been a kind of a two-tier approach. So there would be some national and some local. There is a bit of a myth, I think, that somehow if you have everything commissioned nationally, you have a consistency of service, because that is not my experience. That's not evidenced in the delivery, whether it be externally commissioned services, or whether you look even at just the difference of delivery of work coaches from one job centre to the next. So I think having local level governance is also really helpful to help flesh out challenges where they do arise. But yeah, there have definitely been challenges. Thanks.
What's been the impact of replacing the European Social Fund with the UK Shared Prosperity Fund? Has that made any difference?
Well, I'm quite happy to come in on that. I mean, the first point to make about the UK Shared Prosperity Fund is that in terms of the level of funding, it's not anywhere close to making up for the loss of the European social funding. So however much you devolve, whatever structure you put in place, if there's not enough funding in the system, you've got a problem. So in terms of our survey, 3/4 of third sector organisations said they've experienced a reduction in funding. 6 in 10 of those said that reduction was very significant. 4 in 10 have already had to lay off staff, and a similar proportion expect to do so in the next 2 years. And 15% said their organisation could close within 12 months. There's also huge uncertainty about what's going to happen come March 31st, 2025, when we have a looming cliff edge. We don't know what's going to happen with UK SPF. So the picture coming out from our research certainly in England is that we have a third sector that is really in crisis now, that's really struggling for a whole host of reasons. I mentioned earlier about local authorities not releasing funds. Some are trying to release funds but can't get third sector organisations to take it up. And the reason for that is that the funding available is too short. It's less than 1 year. It's small pots of money. It's having to deal with multiple local authorities with different procurement models. So it's incredibly fragmented. There's lots of bidding going on. And it's creating a nightmare in terms of staff recruitment and retention. And also it doesn't work for the users, because these users need long-term support. And if you've only got 12 months, you're picking people up and dropping them again. And that really does not work at all. So we need multi-annual funding, at least, to support people with long-term needs and to provide them with the long-term support that they want. And we need more accountability of the actual impact of local authority commissioning, whether it is actually getting out there and supporting the organisations that are effective in meeting people's needs.
Thank you very much. Can I ask, in principle, is payment by results a good way to fund employment support? And should we be looking to the newer sort of variations on, like the one that Anna's talked about, the social outcome partnerships? Is that a better way to go? But is payment by results in itself a good approach? Peg, you're shaking your head.
There's quite a lot of research and evidence out there now for payment by results, which demonstrates the kind of the industry terms of creaming and parking. So a tendency to work with those easier to work with to make sure you get your payments. And that happens even within voluntary sector or third sector organisations of scale. I think what you get with payment by results is you get the numbers. So you will absolutely be able to go, look, ta-da, we've helped this many people, and ta-da, this many people have got into work. But whether you are working with the people that you really want to be reaching, that is a very different question. And I think it comes back to understanding that employability is a fundamentally complex issue. It doesn't just reside within what one does to one individual. It depends on the context within which they're seeking work. It depends on whether there's public transport, whether there are jobs, whether there's stigma in the workplace, and so if we just focus on a payment by results model, we sort of instantly take away any insight to all of that complexity. So for example, in Fife, where I was working most recently, we ended up coming up with a model where we looked at, obviously looking at the numbers, because the numbers matter. We have to understand whether people are being supported into work. But we also looked at things like cross-referral to relevant other services. We also looked at performance around evidence of continuous learning, and we created a set of quality criteria which were as important as the job outcome, that we were assessing and understanding what was happening in terms of the services that were commissioned. Because I think it's really important to look at it from the perspective of the people who are seeking work. And we did quite a significant amount of what we call co-production or co-design, service design work in Fife, and that's happening more and more across Scotland, to try and understand what it felt like from the perspective of people using services and seeking support to get to work. And from their perspective, actually, how they were treated was much more important than what services they were given access to. So if they felt respected, empowered, not judged, that the service was discreet, all of these kind of things. That was actually far more important and more likely to lead to a positive and lasting outcome than whether they got a CV or an action plan. So we really need to get more nuanced around that understanding, I think, and payment by results does not.
Would anyone else like to defend payment by results for funding employment support? No. Right.
I don't want to defend it, but I'll say that there is some. I mean, I think from our data we can say that there is, in some of the programs like Work and Health Programme, Restart, Fair Start, if you talk to the third sector providers involved, they will say they get a bad press. They've moved on from the days of the work programme. It's not just about getting people into any job. There's got to be an element now of getting people in there, in stay in work for at least 6 months, and that represents progress. On the negative side, though, I think there's a lot of concern around cherry picking and focusing upon the users that are easier to get into employment, and that still goes on. And at the end of the day, it's not possible to deal with people with complex needs if you've got very high caseloads for people. If you're dealing with 70 or 100 clients, you can't deliver that bespoke, tailored support that you need. And I guess the other thing with payments by results is, what results are you actually measuring? Is it just getting into a program or getting into work? What about distance travelled towards employment? What about the soft outcomes like self-confidence, feeling part of society, self-esteem, family relationships, helping your kids with homework, all those things that third sector organisations help to do, which are really, really important for people and society.
I guess the social outcomes approach is a response to those concerns in a way. Would it be right to see it as a variation on payment by results? How would you describe
I would
it?
say, that social outcomes partnerships are something that we've evolved and been learning about really since some of the initial contracts, sort of over a decade ago. So there's been an evolution of that approach as we've learnt about what works for individuals who are more vulnerable and with more complex needs.
Wasn't it initially around people leaving prison? Was that where
the very original, it was actually called a social impact bond was the terminology at the time. That's again evolved a little bit actually as we've learnt about how these work, was focused on people leaving prison and reoffending rates there. But since then there were a number actually. The DWP was actually a pioneer in creating an innovation fund, which was looking to innovate around some of the outcomes for younger people, for example, there. So there have been a number of programs over the past decade that have developed and built the social outcomes market, if you like, in terms of how that can best work and which issues that can be particularly focused on. So I would say it's as much based on an evolution and building of learning from the 90 social outcomes contracts that there have been in the UK so far, where we're actually a global leader in that, as it is a response to payment by results. And I think some of what I think both Jonathan and Pegs have said is absolutely right. The sorts of outcomes that we're talking about measuring through an outcomes partnership are a more holistic view of progression for that individual. So to give an example, and forgive me, it touches also on homelessness, which I think speaks to the fact that these are complex and interconnected issues. The Kirk League's Better Outcomes Partnership will be looking at a range of measures of progress for that individual. So that's entry into housing and then sustainment of that accommodation over 6, 12, 18 months. But because they also know that a predictor of actually sustaining accommodation is employment, they'll also be looking at measures around entry into employment and sustainment of that employment. And finally, they will be looking at some of those softer measures I think that Jonathan talked about, for example, well-being, family connections, other factors which are determinants of long-term progression towards independence for that individual.
I have to say I'm less of a fan of the kind of softer outcome stuff. I kind of think the point of sort of employment support is to get people into employment, and where we've got further distance to travel, for me that just means that we need sort of more intensive and or longer programs to kind of get them where they ultimately need to go. I think the thing that sort of the common thread that runs through all of the most recent questions is we've all got this kind of shared desire for more people to get better quality support that leads to better outcomes. And what we're really kind of groping around at here is like, is the best way to devolve that? Which bits should we devolve, or should it be national? Should it be payment by results? I mean, for me, the big thing that hasn't come up yet is just there's a distinct lack of kind of data, and particularly sort of comparison data. If you're working with a relatively easy unemployed target group, like unemployed graduates, you might expect a program to get 80% of those people into work fairly quickly. At the opposite extreme, if you're dealing with people with kind of housing issues, substance issues, domestic violence issues, 20% outcome rate might be really good. And what I think we really lack is good quality kind of benchmarked data on outcomes. And I think a lot of these questions about what should be devolved and shouldn't, how do we pay for it, would be much kind of simpler to answer if we had kind of better data on that stuff and the ability to compare not just the outcomes for an individual program, but like to have those outcomes, but to compare them to a kind of sort of sensible comparison.
Interesting, thank you. David Linden.
Hey, thank you, Chair. And I take Mr. Gadsby's point on that. And if we do place to the side the kind of outcomes and the data-driven aspect of it, let's say that a decision's been taken that employment support be further devolved. Can I ask the panel, both in person and virtually, along what boundaries should that be delineated? Should it be county councils, borough councils, combined authorities, health boards, that I think in England it's called NHS trusts? Should it be regions? Who wants to have a go at that?
I'm happy to start.
Okay, thank you, Professor Payne.
Well, I mean, the interviewees that we talked to told us you've really got to think very carefully about the level and scale you devolve down to. What they seem to say about UK SPF is that devolving to lower tier authorities has been a key problem because it's too fragmented, and that you need to devolve to something like a geographical area at least as big as what we might have once referred to as a local enterprise partnership area, and preferably a combined authority. So our interviews are telling us that some combined authority areas are better at this. Greater Manchester, Greater London Authority, because they've been doing it for longer, they've got more experience, the team's in place to do it, and they've got established ways of partnership working with the third sector. What I think complicates it is that we shouldn't assume that all combined authorities are equally as effective as others, because we do hear stories that it's not always great in some of the combined authority areas. The geographical scale is important because you get problems emerging, because a local authority area doesn't map onto a travel to learn or travel to work experience area. So you might have a young person who's in one local authority having to travel across a boundary. Mm-hmm. And then you get a dispute as to which local authority pays for that. You also get problems with UK SPF in that there's areas of the country, say between London and Brighton, where the funding model means that they don't get any UK SPF funding, but they've still got pockets of deprivation. Mm-hmm. If you have funding over a bigger geographical area, you circumvent some of those problems. They don't emerge so much. So I think going back to the last session that you heard, and I was listening to that, you do need to think about doing this at a particular scale, geographical scale. And I think the Northern Ireland situation is also interesting, because there they haven't commissioned down to local authorities, and they haven't experienced the same problems of fragmentation and inconsistency that we've seen in, say, England. They have had problems in terms of getting the funding out quickly enough. But yeah, I mean, in some ways, that's an experiment with national commissioning, because we haven't seen that model that we've seen in England with local authority commissioning of employment support.
Does anybody else want to answer anything else before I move on to my next question?
I think I'd just say, I mean, I don't think we have a specific view, just that we have seen examples of how it can work at local authority level, and we have seen examples of it working at combined authority level. So examples like Skill Mill are working with a number of different local authorities to essentially deliver a similar type of approach in multiple authorities, but it's still working at that local level. There are some great examples from Greater Manchester, for example, around their Homes Partnership, which is working across the whole of Greater Manchester and brings together quite a large consortium to respond to a diverse set of needs within Greater Manchester. So there are a range of approaches that we've seen.
Okay. Yeah. The next... Sorry, Ms Bailey, on you go.
I was just going to add to that and just say I think it probably does depend. Actually allowing those decisions to get made depending on the area is probably quite a tricky but a useful way to consider it. So depending on the size and scale of each area, it may be more sensible for local authorities to team up, or it may make more sense for, actually, if it's a sizable local authority, for them to kind of set up their own partnership and just kind of allowing that to not necessarily be 100% dictated. It might be something to think about.
Kind of preempt the next line of questioning that I was going to come on to, which would be specifically to yourself. So, we've discussed at length this morning the experience in Scotland of devolving employment support to local authorities, and I think you were quite candid when you said that there are lessons to be learned around things like whether it's governance or commissioning. Can you just expand a little bit further on that?
Yeah, absolutely. So I guess just to be clear, so my role was recently created. I started post in January, and I guess it has been part of the learning journey in Scotland. So my role is to work across Scotland with the local employability partnership. So we have one for every local authority, and to share the good examples of good practice, of which there are many, around local authorities committing to multi-annual funding, even though they don't get multi-annual funding at the moment, committing to collaborative working and having really effective partnerships and very flexible local delivery, smaller organisations coming on board, who really connect into the grassroots of an area. So there's some really amazing areas of good practice, and part of my job is to share those stories. And then there are also areas where it has landed differently, where there's been less of an established habit of partnership working, where the confidence of the local authority around commissioning is very, very different. And perhaps, with hindsight, a post like mine, a post like the Improvement Service post, which is my equivalent who works with the local authorities, would be something you would have in place from the get-go to try and kind of mitigate some of those challenges and issues. That said, we also have, so in Scotland, we have third sector interfaces. So they are the equivalent of the Centre for Voluntary Organisations, or CVSs, and they are funded to support third sector engagement in community planning and support capacity building and support volunteering. And in some areas, some local authorities have given their TSI a little bit of extra money to help do that capacity building work, to help build the links between the sector and the partnership, to help make sure commissioning is going to be effective and so on. And in those areas, it's been very, very positive. Part of what I'm doing is trying to kind of grow that. The other thing we have in Scotland is we have the National Third Sector Employability Forum, which is a voluntary membership kind of group with over 400 members of third sector organisations working in the field of employability. So that's another avenue of creating a collective voice to help inform, troubleshoot, and make sure that policy is kind of going to be effective. Yeah.
Can I just ask, before I go on to my final question, do you think there are too many councils in Scotland?
I couldn't possibly comment.
Oh, well, it was worth a try. Okay, and finally, you mentioned the Third Sector Employability Forum. Do you think there would be, and this is the question I think probably to the rest of the panel, do you think there would be an appetite for a similar body in other parts of these islands?
I'm happy to.
Professor Payne.
Yeah, I'm just going to go back to your earlier question first, if I can. I do wonder whether that it is too fragmented with 32 local authorities in Scotland, and trying to devolve employment support to so many, all of which are going to take out an overhead for that. I agree with Pegs that there are some great examples in Scotland of partnership working, really fantastic examples. Dundee, Edinburgh, Glasgow, East Renfrewshire, Fife. But that's 5 or 6 amongst 32 local authorities. The question that our interviewees pose, or where the divisions come, is can you spread that best practice, or are the problems of local authority mindsets so embedded in some areas that, you know, they treat the third sector with disdain, and trying to shift those is going to be extremely difficult. In terms of voice, I think it is important to have a voice that speaks for third sector organisations to government. URSA has an ad hoc forum for the third sector, and it does a great job. It has lots of good connections with ministers, as does the third sector employability forum in Scotland. But the message from our research is that the sector is in crisis. There's a funding crisis, and the sector feels unheard, unloved, unappreciated, that the sector is on its knees, and it's not being heard, and it's not being acted upon.
At the risk of experiencing the wrath of my party press officers, I wouldn't agree too much with you on the number of local authorities, but I'll leave it at that. Thank you.
Thank you very much. Neil Coyle.
Thanks, Chair. And some of these issues have been touched on, I think, but I just wanted to focus briefly on local authorities' capacity. Do you share, I think the word Professor Payne just used was disdain, but do you, what's your assessment of the capacity of local authorities to deliver employment, to commission employment support services? Should we start in the room?
I think it's incredibly patchy and incredibly variable. I think that's the picture that we can say. What some of the interviews tell us is that local authorities have got extremely limited capacity. I mean, we have to remember that there has been a long period of austerity and cuts, and that has denuded a lot of local authority capacity in many areas. And commissioning employment support is not the same as commissioning your dustbin collections. It requires a particular skill set, a particular level of expertise. Some combined authorities, some local authorities have that, and some are a million miles away from it. And before you push funding and commissioning down to local authorities, the logical thing to do is to work out whether the capacity is there, and if it isn't, how would you go about building that capacity and that knowledge and that experience?
Do the other panellists share the assessment? And is there, how would you fix, if it is so patchy, how would you fix it? What support do local authorities need in order to be able to do their job better?
I have to come in. I wouldn't necessarily be able to comment sort of in the whole on the sort of capacity of local authorities, but I think I can speak a little bit to what we've seen around their confidence actually in commissioning on an outcomes basis, which has been growing as they see more examples of it, but there is still not consistent confidence in applying that outcomes-based approach. It's still a relatively new tool for a lot of commissioners, and there's a degree of risk involved in taking that sort of new approach. And some things that we've just seen help have been actually building more of the data and evidence and examples of how it can be effective, and sharing those across local authorities, and initiatives like the Government Outcomes Lab is doing some of the work there to both evaluate and provide some of those examples. But there are also, I think it's right to say, challenges in terms of being able to put together some of these structures, if I can think about it in that way. And one of those can be that not all of the funding streams that are required for some of this approach are necessarily available to that particular local authority. And that's where we have seen some of the central government sort of co-payment models working alongside local authorities unlock some of that potential at local authority level. I think others have talked about the long-term nature of some of both these problems and the need for multi-year settlements around the budgets there, and that can be another constraint. So for a lot of the time, for people with more complex needs, the issues only really emerge in the first year, let alone being able to then design and deliver some of the support to them. So there can be that constraint as well around being able to have those longer-term budget settlements that are required.
Comes back to your point, Ben, about data then, in some ways, yeah.
Yeah, I'm always really struck by the kind of lack of sort of professional networks that bring together people doing very similar jobs in local authorities to kind of learn from each other and share best practice. I always worry that we would want decision makers to be evidence led, and the more decision makers there are, the more people there are that you need to kind of walk through the evidence and explain and help them understand it in their context. I think the more you devolve stuff, there's definitely a role for kind of not just kind of devolve and forget, but like fora to bring together those decision makers to kind of learn from each other and share tips and do joint training and things like that.
Yeah, I would just add to that, actually. I think that's a really good point on the joint training. So I think some of the things that I would say have been put in place now in Scotland and would help mitigate some of those issues, and some of them aren't. But some of the things that the sector have advocated for, a really basic thing is that the person who is in charge of spending the money, whether it's at local authority or regional level, is not the same as the person who's in charge of the internal delivery of employability services, because quite often they already have their own delivery. So you've got a fundamental conflict of interest there. So you want the person who is in charge of commissioning, planning, strategy, making sure this is a partnership thing, to be different to the person who is also in charge of maintaining the internal services. So it's a really simple thing that can be put in place. I think actually maximising the role of, they seem to call them labour market partnerships, I think in Northern Ireland. In Scotland, we call them local employability partnerships. Really building those up so that they are absolutely the collaborative decision-making space where the money is coming, so that the conversation is around the whole budget in that room and that it is strategically considered and multi-annual. And then I do think there is something about this idea about training and learning and building those capacities that you need. You want the regional or local areas to be able to do this work well. And things that I'm thinking about at the moment in my role are around managing diverse perspectives, good practice in commissioning, in employability, understanding the role of consortia. Just these kind of things which actually would enable that decision making to happen effectively on the ground. But the last point I think I would make is the importance of the national infrastructure that supports that. So having facilitators, because it is a culture change program that you're talking about, of multi-million pounds rather, coming through, that is making sure that you have almost like a national equivalent to your labour market or local employability partnership, where issues can come up the food chain and come back down the food chain, where those people can work locally to pick up issues very early and to support the journey of change that you're asking, that you might be asking to happen. So I think investing in some of that kind of infrastructure at a national level to support devolution is really critical, and not just hand it over and think that somehow it's all going to be sunshine and roses, because I think the experience that we've had has shown that doesn't always land that way.
The need for longer term contracts has been raised several times. I'm assuming the whole panel agree that would be beneficial to those bidding as well as to the people who need support over time. Is there anyone who disagrees? No. Good. Right, that's an easy one.
Well, I guess a slight caveat. I mean, one of the things I would want to see over time would be higher quality provision growing. And I think there is a risk sometimes if we have kind of contracts that are a fixed size for a fixed period, that can effectively be a barrier for growth. So kind of if there are long-term contracts, making sure that we've got space in them, like as we kind of develop evidence about what's working and what's not, to grow the things that are working and shrink the things that aren't potentially, rather than kind of locking in for 5 years.
That's a really, really interesting point. I mean, Professor Payne painted quite a bleak picture for the third sector. The crisis, I think, was the word used a couple of times. Is that has that come about because of the way the contracts have devolved, or is it the short-term nature? Is there a different experience amongst the panel around devolving employment support on the process?
So one of the things that really struck me, my background really is education more than employment, and when I first started work on employment stuff, I hadn't worked on anything where the demand goes up and down so dramatically over a period of over a couple of years before. Like schools, it's pretty predictable how many people are going to be in schools and stuff, but if you think about kind of recessions and return from recessions, the kind of demand for employment support services can go up and down by kind of 20% in a couple of years, and that is a significant thing to manage for an organisation, being able to scale 20-50% over a couple of years to deal with increased need, but then also potentially to have to scale that down again and then come back again over a sort of 10-year period or whatever in line with an economic cycle. I've always been really struck by that.
But the flex is in the system to be able to do that, is it?
I don't know that it's easy to flex your organisation to do that. Like that involves hiring more people, training more people, then making them redundant, and then 3 years later hiring more people again.
Any other specific comments on devolving employment support? No?
I think you've got a perfect storm.
Sorry, say again, Professor Payne.
I think you've got a perfect storm because you've got, first of all, government being extremely late in getting funding out to the third sector. We know that the people and skills support element was massively delayed. Then you've got a huge amount of funding sucked out of the system with the loss of the European social funding. So there's less money in the system. And that is a big part of the problem that we're skirting around, you know, the lack of funding there. Then you've got the fragmentation, the multiple bidding, the short-term contracts, the fact that there's an assumption that the third sector is out there and it can, you know, you can pay them in arrears, and they've got huge reserves they're sitting on to pay for their staff when they've not got funding coming through their doors. They haven't. You know, I'm really concerned by what I hear from the third sector about the fact that the capacity is being so reduced that even if we turn around tomorrow and say, hey, we need this sector to come and solve the problems of economic inactivity, it might not be there. The staff are being lost. The capacity is being eroded. This is serious, and we need to really recognise what the third sector does. We need to value it, and we need to make use of it.
I agree. I think there were ministerial commitments to replacing social fund post-Brexit, and is this maybe the committee needs to double-check what's been delivered? And
well, this is the UK Shared Prosperity Fund, isn't it? Which, as Professor Payne says, we don't know what's going to happen to it after March next year.
Has it been delivered to the same level? It was something I need to look perhaps afterwards. But then, final question for Chair is around, given the difficulties you've expressed, what support is it the third sector providers need in order to be more successful and to deliver the goals of this or whoever is the next government after next election?
Well, without doubt, they need certainty in terms of funding going forward. So we need to know what is going to happen with UK SPF come March 31st, 2025. And if we can't be clear on that, we need at least an interim arrangement that funding will roll on for a year while whatever government, whatever political stripe decides what it's going to do next. And as many people have said, we desperately need to have longer term funding in order to restabilise the sector. That is absolutely critical. You can't run a sector on funding that is for less than 1 year, and turns out by the time you've got your money, you know, you're trying to run a programme for 9 months. So multi-annual funding is key, but also certainty going forwards.
Is there any other support anyone wants to suggest, either from DW or elsewhere? Yeah, go on, Pegs.
I think the point has been made about the importance of fair and transparent commissioning models. But clarity of budget early is one of the most important things you can do, and then multi-annual. Absolutely, taking on point the point that sometimes a little bit of money for short term and test to change, great, but fundamentally longer term multi-annual. I think effective voice is an interesting one. So making sure that there are, as is now happening in Scotland through my role and as we have through the TSEF, making sure there are effective routes to work alongside the policymakers, to work alongside ministers, to ensure that the plans are properly, the risks and opportunities are properly considered and assessed, and the solutions are put in place maybe before they arise rather than after. So I think really that's probably a very important thing. And just in case this is my last chance to speak, to say, why would you care about making sure the third sector has all those things? I think it's really important to just re-emphasize this point. Third sector organisations are working with the furthest from the labour market. They are non-profit organisations. Everything they do is reinvested back into either their local area or within the national space. They are not taking money out of the system and putting it elsewhere. And I think that is absolutely critical. They are integration personified when it comes to the kind of things that I think the employment system is trying to achieve. So I think there is a really strong reason to make these investments and to hear the concerns and listen to how they can maybe be addressed, because I think they can be addressed. I don't think this is a kind of it's all doom and gloom. And Jonathan's point about confirming UK SPF or whatever replaces it, please, soon would be good.
So co-production, funding, and length of contracts. Any other points?
I think sort of specifically in the context of where we're trying to tackle the more complex needs for more vulnerable individuals, a clearer commitment to actually using outcomes commissioning and partnerships, and potentially designating certain amounts of existing spend for that purpose would give a signal and embed this approach much more and ensure that the value that Pegs has just talked about, that third sector organisations contribute to delivering those, is really integrated into the design and future commissioning of such programmes.
One final point to mention that's really important is, I don't know whether we're going to come on to this, but it's really significant, and that is the impact of the private sector primes in the market, particularly in England, and the effect that is having on third sector contractors. So we hear a lot of reports about the third sector organisations being forced out of the training market, the employment and training market, because of these large private sector primes. The primes using third sector organisations as bid candy to get contract, but then not providing them with any referrals. We also hear about third sector organisations being exploited by national private sector contractors who cream off huge management fees of 40% in England that then do not flow down to the third sector. And this is in a period of when money is tight. And it's interesting that Scotland is different. The big private sector primes haven't managed to penetrate the market in Scotland because Scottish government isn't willing to allow the primes to take a 40% management fee. It's much lower. And third sector primes generally do a better job in terms of supporting and building capacity amongst their supply chain. So we really do need to look at the market in England and whether it's functional in terms of how the private sector primes are operating.
And what you've said applies to all private sector primes, or is it variable between the different private sector primes?
I don't think that our data is granular enough to answer that question. But all I can say is that from the interviews that we've conducted and from the survey responses that we've got, there is a great deal of concern about how the primes act and how they treat the third sector organisations, which is compounding all of the other problems we've spoken about today.
Okay, understood. Fine, thank you. Can I just ask Anna, finally, can you just give us one or two examples of a social outcome partnership addressing employment? What does it look like? Who does it?
Maybe a couple of examples. So I think I touched on one called Skill Mill, which is specifically focused on young people who are leaving the justice system, often without prospects towards employment or necessarily sort of other opportunities for training. So they're working with those young people.
Is this in a particular locality?
They're working in, I think, 7 or 8, I'll give the exact details, local authorities to deliver that. And they're working with those young people to help them get actually real paid work placements, working with local employers to gain the right qualifications, and also to work on building their confidence and well-being through that. So that's an example that we see.
And that's funded by investors, is it?
So that's in the sense that the funding comes from an investor to deliver the upfront service delivery. So that comes from actually in that instance a social outcomes fund run by Big Issue Invest, who provides that funding, and that then allows the charitable organisation essentially to deliver the support to the individuals. And then there is a series of established outcomes payments which are only paid out after they're actually demonstrated and evidenced to have been delivered.
And the local authorities pay those?
Exactly, so there will be a local authority and other sort of commissioners who pay for those. What we tend to see, as I've alluded to, is models where there's some element of that is local authority commissioning and payment, but actually often a contribution that comes from central government in a sort of co-payment model. So there have been a number of funds, like the Life Chances Fund, which was set up originally by the Cabinet Office, is now managed by DCMS, which effectively offer that co-payment model to reflect, as I touched on, the fact that some of the benefits of these approaches do kind of accrue centrally rather than locally, and also to help overcome some of the barriers that might exist for local commissioners in terms of adopting this approach. And the other example I touched on, which although it was actually is about homelessness, it's also about employment, was the Kirklees Better Outcomes Partnership, where they were originally finding that their very specified sort of service model wasn't working as well for people with complex needs who are potentially representing and coming back, and they were perhaps addressing, if you like, the symptoms and for the individual rather than the root causes. So the Outcomes Partnership that they have, which is commissioned by Kirklees Council, again with a top-up from the Life Chances Fund, allows them to take a much more personalised approach to that. So if an individual, for example, is sort of somebody who might be leaving prison, doesn't have a job or a home, the established pathway might be for them to go straight into special, supported accommodation, which actually has implications in terms of their ability to get a job. By listening to individuals, and this is a sort of real case study, they found that person actually really wanted to focus on their path towards employment and re-establishing family connections. So instead of funding the standard pathway, they actually fund that individual to gain a qualification, support them with employment, and also help them with private rented sector accommodation. So that's supporting them on that path towards independence. And what we've seen actually, that particular case study, it also brought together, I think, quite a lot of fragmented programmes of support across the council that might have been touching those different individuals but weren't necessarily being brought together. It's still being delivered by 8 third sector organisations who bring their own specialism and knowledge to that, but they're able to bring that together around a particular individual, and there's some positive evidence around what that's delivering by way of employment outcomes and also housing outcomes for people.
And you said that the UK is a leader in this. And did you give us a number for how many there have been?
90 so far.
19?
90.
90?
Yes.
Since sort of 2008 or something?
Broadly speaking, yes, yeah.
Very interesting. Well, thank you all very much indeed. That concludes our questions too. We're very grateful to all of you for being willing to help us out this morning. Thank you. Order.
Indeed. The proceeding has ended. 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 The proceeding has ended.